Good evening, everybody. Today we are going to do obstetrics and gynecology. Obstetrics and gynecology is a very important subject. It covers about 25 to 30 questions, which are very important, and you can score full marks in this subject if you are able to practice this nicely. So, let us begin with the first multiple choice question. Which of the following decreases in pregnancy? Which of the following decreases in pregnancy? Let us look at the options. A. Respiratory rate. B. Vital capacity. C. Inspiratory capacity. And D. Functional residual capacity. So, which decreases in pregnancy? Respiratory rate, vital capacity, inspiratory capacity, functional residual capacity. Let us look at the options. So, the correct option here is functional residual capacity. Now, what happens in pregnancy? The functional residual capacity decreases. The total lung capacity decreases. Obviously, there will be bulge, so total lung capacity will decrease. Residual volume decreases. Tidal volume increases by 30 to 40%. Minute oxygen uptake increases. Minute ventilation increases. Inspiratory capacity increases. Inspiratory reserve volume is unchanged. This can be asked as a question. Vital capacity, respiratory rate, unchanged. Vital capacity, respiratory rate, inspiratory capacity. Inspiratory capacity increases. Vital capacity, unchanged. Respiratory rate unchanged. Functional residual capacity decreases. Total lung capacity, residual volume decreases. Tidal volume increases by 30 to 40%. Minute oxygen uptake, minute ventilation increases, inspiratory capacity increases. So if you master this MCQ, if a similar MCQ comes, you can solve that easily. So let's move on to the next question. Please click the link in the description box to join the ultimate Neet PG breakthrough event. This will be very helpful in your uh, securing a good rank in your Neet PG 2025 examination. Let us move on to the next question. You can directly WhatsApp me on the above given number 9483652020. A 45-year age woman having 2 centimeter submucosal fibroid with menorrhagia for 6 months. First line management is A. OCP for 3 months, B. Progesterone for 3 months, C. Hysterectomy, D. Endometrial sampling. The correct option here is endometrial sampling. 45-year age woman, 2 centimeter submucosal fibroid with menorrhagia for 6 months. The American College of Obstetrics and Gynaecology (ACOG) recommended endometrial assessment in any woman older than 45 years with abnormal uterine bleeding, and in those younger than 45 years with a history of unopposed estrogen exposure, such as seen in obesity or polycystic ovarian syndrome, failed medical management, and persistent abnormal uterine bleeding. Then the management is done accordingly depending upon the HPA report. So you have to do the endometrial sampling. So correct option here is endometrial sampling. The major contribution of amniotic fluid after 20 weeks of gestation is A. Fetal lung fluid. Is it ultrafiltrate and maternal plasma? Is it fetal skin or it is fetal urine? It is fetal urine. Fetal urine is a major contribution for amniotic fluid post 20 weeks. Early pregnancy, the amniotic cavity is filled with fluid that is similar in composition to the extracellular fluid. During the first half of pregnancy, transfer of water and other small molecules take place across the amnion via transmembranous flow, across the fetal vessels on the placental surface via intramembranous flow, and via transcutaneous flow across the fetal skin. Fetal urine production begins between 8 and 11 weeks of gestation, but it does not become a major component of amniotic fluid until the second trimester, which explains why fetuses with lethal renal abnormalities may not manifest severe oligohydramnios until after 18 weeks. So the correct answer here is Fetal urine. The major contribution of amniotic fluid after 20 weeks of gestation is fetal urine. Let us move on to the next question. Before moving on to the next question, you please click the link in the description box to join the WhatsApp group for the Neet PG revision event, Ultimate Neet PG revision event. What is the treatment of choice for female with atopic vaginitis with complaints of itching? A. Topical estrogen. B. Antihistamines. C. Hydrocortisone. D. Antipyretic. The correct option here is topical estrogen. Now, what happens in atopic vaginitis? You can use topical estrogen cream, 1 gram of conjugated estrogen cream intravaginally each day for 1 to 2 weeks generally provides the much needed relief in atopic vaginitis. Systemic estrogen therapy should be considered to prevent recurrence of this disorder. So the correct answer here is topical estrogen. Please like, share, and subscribe, and hit the bell notification so that you get the video as soon as I upload it. A pregnant woman with fibroid uterus develops a severe acute pain in abdomen at 28 weeks of gestation. There is no history of fever. WBC count is 8,000 cells per microliter. The most likely diagnosis is A. Preterm labor. B. Red degeneration of fibroid. C. Torsion of fibroid. D. None of the above. C. WBC count is 8,000 cells per microliter, which is quite normal. Severe acute pain in abdomen at 28 weeks of gestation. There is a fibroid, is there? So it can be torsion of fibroid. In this case, there is a severe acute pain abdomen without fever, without fever, and normal leukocyte count in a 28-week pregnant woman with fibroid. The most likely diagnosis is torsion of fibroid. Torsion of subserous pedunculated fibroid presents with severe pain abdomen, but fever and leukocytosis are characteristically absent. Red degeneration of fibroid presents with acute pain abdomen, vomiting, leukocytosis, and raised ESR will be evident in case of red degeneration of fibroid. Let us move on to the next question. Which of the following is true about paroxysmal PNH? Which of the following is seen in vertex presentation with complete flexion attitude of head? A. Suboccipitofrontal diameter. B. Suboccipitobregmatic diameter. C. Occipitofrontal diameter. D. Occipitoposterior diameter. It is suboccipitobregmatic diameter. Suboccipitobregmatic diameter is seen in vertex presentation with complete flexion attitude of head. It is the smallest diameter of fetal head. The smallest fetal diameter is head is bitemporal diameter. The longest diameter of fetal skull is mentovertical diameter, 14.5 centimeter. Second longest diameter is submentovertical. The, the commonest type of presentation is vertex. So the correct answer is suboccipitobregmatic. Nuchal translucency time in USG can be detected at dash weeks of gestation. B 6 to 8 weeks, B 11 to 14 weeks, C 11 to 16 weeks, and D 16 to 20 weeks. The correct option here is B 11 to 14 weeks. Nuchal translucency NT scan. According to Fetal Medicine Foundation guidelines, NT scan performed at generally around 11 weeks. In certain abnormal fetuses, the lymphatics of subcutaneous tissue are defective and this results in increased fluid collection, hence abnormal nuchal fluid thickness. A nuchal transparency more than 2 mm is associated with significant fetal anomalies. However, this is a crude cutoff and the actual NT varies with gestational age. In a low ovarian reserve, anti-Mullerian hormone level will be A less than 1 nanogram per ml, B 1 to 4 nanogram per ml, C more than 7 nanogram per ml, more than 10 nanogram per ml. It is less than 1 nanogram per ml. In low over AMH level will be less than 1. AMH is a peptide secreted by Sertoli cells in the testis and granular cells of ovary. In males, AMH starts to be secreted by 7th week of intrauterine life. A patient presents with recurrent miscarriage is now diagnosed with antiphospholipid syndrome. What would be the best treatment for her? A. Aspirin only. B. Aspirin and low molecular weight heparin. C. Aspirin, low molecular weight heparin along with prednisolone, aspirin and testosteroids. The correct answer here is B. Aspirin and low molecular weight heparin. In pregnancy, low molecular weight heparin with aspirin 80 mg daily is the most efficacious regimen. Aspirin doses of 60 to 80 mg blocks the conversion of arachidonic acid to thromboxane A2 while sparing prostaglandin production. Heparin therapy prevents thrombosis in the microcirculation, including residual trophoblastic interference. Corticosteroids are not to be used in primary antiphospholipid syndrome. Warfarin is not used due to potential teratogenic effect. Please like, share, and subscribe. And please click the link in the description box to join the ultimate Neet PG Masterclass.